My name is Dr. Marlin McKay. I'm a general practitioner in private practice, and I'm based in the suburb of Florida, which is part of Roodepoort, here on the west rand of Johannesburg. Okay, so the way science works and research works, getting consent from someone who is pregnant to be involved in trials is always challenging, especially when you have to administer drugs that have never been tested on pregnant women before. So there's always what we call a paucity of data in pregnancy. Hence, when you open the package insert of most medications, you'll find the line that says safety in pregnancy and lactation has not been established, meaning we just don't know. And if you look at most of the data since the pandemic started, there haven't been many studies that have been done on pregnant women in terms of outcomes, right? But if you read the literature, there are small pockets of centers where studies have been done and where they've basically compared the outcomes of pregnant women who have been diagnosed with COVID, compare them to non-pregnant women with COVID, and compare the outcomes. In other words, how did the pregnancy go, how did the delivery go, and how's baby? And most of the studies so far, albeit small studies, selected studies, have shown that there has not been much difference within the two groups. So mums have done well in both groups, babies have done well in both groups, and to my knowledge, there may be one or two anecdotal evidence, but there has not been significant transmission, what we call vertical transmission from mum to the neonate, to the newborn of COVID-19. And even when the mum has developed COVID pneumonia late in the pregnancy, still a good outcome, and still the baby has been fine. They maybe just had to do cesarean sections a little earlier to protect the baby, okay, which is a good thing. So in other words, what we are saying is that being pregnant does not mean that you have to be more overly concerned about the safety of your pregnancy, your life and baby compared to someone who is not pregnant. And if you compare that to H1N1 a few years ago, I think that's good news, that the outcomes are much the same. So remember, it's primarily a lung infection, it's a pneumonia. But a lot of the way your body fights infections is the response of the immune system. And sometimes the immune system goes crazy and creates an exaggerated response. And part of that, it sends all these inflammatory markers, your CRP, interleukins, and can create what we call a cytokine storm. And with that happening, one of the complications can be what we call a coagulopathy, a whole cascade and crisis of blood clots. And some post-mortem studies have shown all these micro clots within the pulmonary system, and that can cause death. But the primary cause of death is a respiratory pneumonia. And now you get a lot of fake news that say, no,